Today's session is all about design trends in design in medical products. Design is at the heart of creating modern medical products, not just for its aesthetics, but also to ensure that they're functional, user friendly, and safe. And right now, design trends are focusing on creating intuitive and accessible devices, often at home use, so they can be operated with minimal training. And this talk will explore the process and challenges involved in designing contemporary medical products while keeping up the latest trends in technology. And let me introduce to our speaker for today, Dr. Saleem Ahmed. He's a true leader in industrial design, currently a professor of industrial design at the VIT School of Design, or VSign, in VIT Vellore. He's also founding dean of VSign from 2018 to 22, and previously led the MDes program there from 2016 to 18. Dr. Ahmed holds a BE degree from NIT, Tiruchirappalli, and MDes degree from IDC IIT Bombay, and a PhD from IISc Bangalore. With over 20 years of industry experience, he has successfully designed and developed more than 200 consumer products for the international market. After his time in the industry, he has transitioned to academia, where he has been teaching and conducting research for over 2 decades. His research interests span product aesthetics, product semiotics, and medical product design, fields in which he has taught courses to both BDes and MDes students. We're honored to have you here, sir, and please join me to welcome Dr. Saleem. Over to you, sir.
Thank you, Namia, for the introduction, and thank you, Professor Prasad Onkar and Professor Seema, for inviting me to give this talk. Now I share my screen and start my presentation. So, design is trending now in medical products. Let us see how it is. The outline of my presentation is I'm going to talk what is medical product design, then how medical product design is different from other designs. Then I will touch upon how are medical products classified. Then why should designers learn to do medical product design? Then some examples of my own medical product designs and my students' work. And what is trending in medical product design now will be the last I will be presenting. First, what is medical product design? This is a definition of medical device. A medical device is an instrument, apparatus, in vitro reagent, implant, or other similar related article which is intended for use in diagnosis of disease or other condition, or in the cure, mitigation, treatment, or prevention of disease, or intended to affect the structure or any function of the body. It's a definition of medical device. So any design of a medical device comes under the field of medical product design. So obviously there is a human life involved. So the designs that people do must be very, very important, and one should take utmost care while doing a design. How a medical product design is different from other designs. A medical product must be sterilizable. We cannot have something which can infect diseases to people. So it should be, hygiene is very important. So in a medical product design, there should be possibility of sterilizing the product so that it is very sterile while it is used on different people from time to time. Something like autoclaving, that is using steam. One can make that, some of the medical products sterile. Or if there are electronics involved, we use gamma radiation or ethyl oxide. These are all different methods of making a medical product sterile so that it can be used on different patients. Sometimes inside the operation theater, when the body is open, if it is not sterile, the patient may get infected. So it is very important. That way medical product design is different from other designs. A medical product must also comply with the conditions of the statutory regulations. Human life is involved. If there is anything wrong, then somebody may lose life. So utmost care must be taken, and many times the patient may not know what product is used on the patient. And it is the responsibility of the governments to take care that anything used on patients are of safe nature. So there are regulatory authorities governing all this, and the statutory requirements are important. And different countries have different ways of regulating these things. In India, it is the Central Drug Standard Control Organization, CDSCO. In the USA, it is FDA, Food and Drugs Administration. And in the Europe, it is EUMDR. And countries like Japan, Australia, China, they all have their own regulatory authorities. And if you take care of FDA or EUMDR, you can be sure of giving your product to international market. And for India, it is CDSCO. How are medical products classified? Medical device is classified according to the risk it poses to the human life. Something that is very low risk, like gloves or the tongue depressor or face mask, they are all in class A, low risk levels. Class B is low to medium risk. Class C is moderate to high risk, whereas class D is high risk. Products that are used on brains, products that are used on hearts, they all come under the classification D. In India, we have this class A, B, C, D. In the US, it is class 1, 2, class 1, class 2A, class 2B, class 3. So they also have 4, but in the category 2, they have 2A, 2B. These are some of the examples of different classes of medical products. Under class A, product like examination gloves or tongue depressor, they all are in that. They are low risk. Class B is low to moderate, like powered wheelchair, infusion pump. And class C is little more riskier, lung ventilator, hip implants. And class D is a very high risk product, like implanted pacemakers or implanted cerebral stimulators. Anything to do with brain and heart, usually they all fall in the high risk category. And any software that is used with any of these devices, they also get into the same classification category. Okay, now why should designers learn to do the medical product design? There is a growing market of medical devices internationally. 600 billions presently, the market size. 600 billion is a huge amount. This is most of, nearly 400 billion in this is from the US, and other 200 rest of the world. In India, this number is about 11 billion, only 11 billion. But this number is going to grow internationally. Internationally, in about 10 years, this number is going to double. This may become about 1.2 trillion US dollars by 2034. And in India, in another about 6 years, by 2030, this number $11 billion will become something like $60 billion. This is about nearly 6 times, 5.5 times. And that is going to be a huge impact. Many designers to fulfill that gap will be needed. There is a niche opportunity for product designers, and there is a dearth of trained designers for medical products. From 11 billion US dollars, when this becomes uh, about 60 billion, so many new designers, so many new companies are required to produce these medical products. So there is a tremendous opportunity for product designers to get into this field, medical product design. And government is also now encouraging, they are setting up medical design parks. One such thing existing in Hyderabad and several other cities, and it is going to grow. So there is a huge opportunity for product designers to get into this field. Okay, here I'm going to present some examples of medical product design where I had been part of. This is one of the student projects, handheld stadiometer design. Here, it's a very simple design, class A, to measure the height of a person. This is to be used using infrared rays, and the height of the person in centimeters will be displayed on the in the corner. So it's a very simple device, handheld stadiometer. Makes the job of measuring somebody's height so simple. And for this design, the student, three students did this, and they used the toucan, the bird, as the inspiration to do this design. That's why this color and the form. This is ambu bag design done by three beta students. This is to be used inside an ambulance while transporting the patient from any accident spot to the hospital. This is to be used, and they came up with a design like this. And this is designed by two MD students. This is orthodontic brush. That particular student, Heyman, he was wearing the orthodontic for his teeth, and the tooth aligners, and with that, brushing the teeth was difficult for him. So from his personal experience, he wanted to have a product that is simple, and one is able to clean the teeth along with the orthodontics. So he came up with a solution like this, and very interesting solution, a flexible toothbrush where he can fix it in the index finger and use it. And now I'm going to show a project where I was part of. When this project I did, I was with IISc. I did this project as part of the APDAP's, through APDAP lab there. It was in 2011. This project was done for L&T Medical, and later L&T Medical was sold to another company called Scanray. So Scanray is one of the top 3 or 4 medical product design, medical device design companies in India. So for every design, we take some theme and give the expression. And this design, you see, inspired by Penguin, and it is an anesthesia machine. So usually, the anesthesia machine is inside an operation theater, and the patients are usually very tensed, because if it is the first surgery for the patient, the person would be even more tensed. So to soothe the person, we thought of some themes that could ease the experience of the patient. And one of the ideas we had was this penguin, which is a very, very friendly animal. And we thought that this could work, and we came up with a form like this, inspired by penguin. And all the technical requirements of the product were taken care of. And the way the cylinders were fixed on the backside, and the different gauges, the displays, and the casters, the space for writing, everything all taken care. And the final expression is inspired by the penguin. You see the LNT logo, where suppose the usually the eyes of the penguins are. So it gives a very nice feel. This is another design inspired by onion. Onion is a medicinal vegetable, and but you peel one, the same thing appears again. Peel another again. So inspired by that, this form was derived, and so multiple repetition of the same element you see here. It's a very contemporary product form, but inspired by the onion. This is infinity, you know. So one of the requirements of the product is to have a large handle so that it can be moved around inside the operation theater. And here, since we said infinity, we made the stainless steel handle run infinitely all around the product. It is endless. It is running all over, and fulfilling all the technical requirements, and the thematic expression infinity also achieved. This is another concept that we offered. Slab is the theme, and this is the concept the client finally selected. But all the marketing people wanted to have the penguin, and that time they felt the penguin may be too much, very different from whatever there in the market, and they didn't want to risk. But however, they wanted to go for this the slab concept, and later, after a few years, wanted to go for a concept like a penguin. But unfortunately, after 1 year, LNT Medical got sold to Scanray, so that never happened. But I'm happy to inform you that even today, this design is being used by Scanray. It is still being manufactured and being used. One could see these products in the hospital marketed by Scanray. These are the other detailing of the product. They wanted the LED light, and the anesthetist will be sitting next to this and constantly monitoring the patient. And from time to time, the person will be noting down something. So they wanted a table-like thing. So all these things were provided. And here you see on the left is the computer rendering of the product, and on the right is the product at launch. That's why you see those in our traditional Indian way of launching a product with the plantain, the small plantain trees, etc. So even now it is being successfully used. So this is one of the medical products where I was part of. I'm going to present one other medical product where I was part of. This is called the personal nutrition monitor. And for this, we took several themes, and one of them was Dachshund, the dog, Dachshund. So it is a product like this, inspired by Dachshund, and this is how the product is used. It is an electronic scale with features like able to give the calorific value of whatever being measured, whatever being weighed, and also the person, if it is for a family, all the family members can enter the names, and whatever they eat on a particular day all can be stored, the weight of it, so that the the calorie level, the amount is maintained, and the end of the day they would know how much calories they consumed, and this would help them to maintain health. If the nutritionist advise them to take certain amount per day, one will be able to measure and maintain that. It is for that, and that's why it's called personal nutrition monitor. And another concept that we presented was this Concord. Concorde, as we all know, was a very nice commercial airliner, the fastest. Could go more than one max speed, and very sleek form like this. So much so during takeoff and landing, the nose used to tilt about 15 degrees so that the pilot could see the runway well, and that sort of thing. But I think about 20 years ago, this aircraft was grounded, and now no longer in these high-speed aircrafts are being used because of the noise pollution. And but very very sleek, popular aircraft, and this is the product form. This is how from the side the product looks, and because of that you see some empty space in the front. Otherwise you would never be able to achieve the product form, but very sleek and contemporary form for this personal nutrition monitor. And they also required a USB port for taking the data out, and all these things provided in a manner that is not obstruting the visual of the product. It's not in the front side. Some other visuals of the same. The process of making medical products and some of the examples where I was part of. Now, I also explain to you how this field is growing, and there is a huge potential that is existing for all new product designers. In the years to come, the field of medical product design is going to grow, where the design is going to play a very crucial role. The new designs, we need to take care are these areas. The functionality, the design should ensure good, safe functionality. It should never fail. It should be fail proof. So functionality is a very very important thing, where the designer should be very very careful while delivering. The user experience is another thing that is very important, and the design should be very intuitive and easy to use, so the users are very satisfied and also feel very comfortable using a product. And as I already explained to you, medical products should comply with the regulatory rules. And from country to country, these regulatory rules are mildly varying. But for whichever country you are designing a product for, you should comply with their regulatory rules. The regulatory compliance is very important, without which your product will not be permitted to be introduced in the market. And safe, efficacy, quality, all that should be maintained. And miniaturization is something that is now coming up with the development in electronics. We are able to make much smaller electronic package, which enables us to make medical products with very small size, and delivering that is a possibility now, which was not the case some 2 decades ago. Now there are health monitors which are as small as wearing a ring on your finger, and that collects all the data, and all your personal health related data is acquired, and you are able to manage your health using just that device, which is as small as ring on your finger. Artificial intelligence is playing a very very important role these days, for diagnostics, treatment planning, and very personalized care. And all these things also make the process very error free, which is the new advantage we have using these. Then internet of medical things. Now many of the devices are connected and they interact between themselves, and some data sharing happens, decisions are made and executed, and one should bear this in mind and understand how these things work and use them in the designs. So technical advancements, designer also should understand and grow with it. Patient centered design is something that is very important, and when you do a design which is patient centered, it will make the product very desirable. So you should be able to make a product which is customized, so the person feels very happy, the way one interacts with the product, all that. If it is customized, the person feels more more happier. And accessibility aspects are very important. Sometimes you do a design for people who are aged and they have their own difficulties. Smaller fonts they will not be able to read well, or if it makes any sound, click, anything should be louder so that they will be able to hear. So those are the requirements of people with disabilities or people who are senior citizens, and the designer should bear in mind these things and do a design so that people of all kinds will be able to access the design. And ergonomics and aesthetics are very very important. If you want to make your product comfortable to use, one should comply with all the human factors. These days, any product that you do, if it is sustainable, then it is going to have more acceptable in the market. And now government is driving these 17 sustainable goals, and the designer should bear in mind, use the materials which are recyclable, use components which are biodegradable, and or make a product with which are energy efficient. Now all these sustainable solutions should be borne in mind when the designer is attempting any product design, more so in medical product design because it's a growing field. Then innovative user experiences is something that the designer should bear in mind. Intuitive interfaces is something that is simple, but without much training, one should be able to comfortably use the product. The interface should be such, and one should be able to easily personalize the product, which will make the product more lovable and used error free by the users. Also, to avoid boredom while using a product, gamification techniques, etc., can be used so that the patients do it like a game, but at the end the data, required data, is collected. So these are all some of the strategies designers may keep in mind while conceptualizing medical products. Without regulatory compliance, medical product finally will never see the light of the day. If you want your product out in the market, you need to comply with the regulatory regulations wherever the product is being introduced, India, US, Europe, anywhere. And for which one should keep make the product very safe, and all these regulatory compliances are taking care of the safety, efficacy, quality, so that end the life, the safety of the patient is ensured. All these compliances are to make the product more safer for the end users, for the patients. If the product is not kind of, if a patient loses life, then all questions come up. And then finally, if they find that there is a design error which led to this, then designer should, it may feel very bad about it. But whatever design you do, finally, if the regulatory authorities approve, means they have considered and accepted your proposal. So you're not directly responsible, but when a product fails, somewhere it may hurt you. And also, to save time of introducing a product in the market, you must keep all these things in mind while doing the design, so that later the designs don't come back to you for rework and trying to fit in certain regulatory requirements. And while doing so, so many a times, whatever original aesthetics that you thought of, or the ergonomic that you thought of, all get affected, and the result may not be very pleasing one. So remember to list down all the regulatory requirements upfront while you start conceiving a design, so that you can save time of redoing, etc., which may happen later if it is not considered in the beginning. Designing for accessibility, using universal principles, so you can make a product which are usable by people of different abilities. Sometimes people become temporarily disabled, maybe due to accident. The person may be on a wheelchair. For making a person like him comfortable using a product, you may bear in mind those requirements. And there are people who are permanently disabled, so for them, the solution that you give should be of that nature. And for a person in that category, would require more comfort, and even spending more money, because it is of permanent nature. Such requirements will be accepted, and you can deliver solution accordingly. uh, Also, adaptive technologies can also enhance your design, which can be used by people of different nature. You can use voice control, braille displays, so that people of different requirement can use them. Then assistive devices are now being used by people of different ages, people who are temporarily disabled due to accidents, or people who are aged, who may require assistive devices to complete their life, their daily living. um, so for seamless daily activities, assistive devices are very useful. And all these things require the designer to bear in mind the accessibility issues while designing. 3D printing, virtual reality, nanotechnology, these are all the emerging trends, that that help designers to come up with the designs which are very futuristic, or able to use a product which which are error free, or using things like nanotechnology, drug delivery, which is very personalized, and making the drug be delivered at some required time intervals, etc. Such kind of programmed way of doing, etc., possible. And when such new technologies are available, the designer should delve into that by studying and understanding the requirements of such technology, and delivering as a product. For I would like to conclude by saying that the future of medical product design lies in blending the technological advancements with a focus on the user needs, the sustainability, and regulatory compliance. So we have to blend the technological advancements by keeping in mind of these three aspects. And by this approach, we can ensure that development of innovative and accessible medical products that improve patient outcomes and enhance healthcare delivery. So with that, I would like to conclude. Thank you.